Introduction to Breakthrough Heart Treatments. Welcome to the official GlobalRPh YouTube channel. If you haven't already, hit the subscribe button to stay updated with our latest videos. Then, stay to the end for the frequently asked questions section. The growing challenge of cardiovascular disease. Cardiovascular disease remains a leading health concern in the United States, taking more than 850,000 lives each year. This week holds particular importance in cardiology as innovative treatments come to light. Looking ahead, the number of adults affected by cardiovascular disease is expected to rise sharply from 11.3% to 15% of the U.S. population by 2050, impacting up to 45 million people. Alongside this, the economic cost is projected to triple, reaching $1.344 trillion, placing considerable pressure on healthcare systems across the country. Recent advances in cardiology offer new and effective solutions. Anti-obesity medications such as Semaglutide and Tirzepatide have shown impressive results, reducing major cardiovascular events by up to 20% in patients with existing heart conditions. Additionally, artificial intelligence is revolutionizing cardiovascular care by using machine learning algorithms to interpret complex medical images and predict potential heart issues. When combined with new patient-centered interdisciplinary care models, these innovations mark good progress in tackling the growing challenge of cardiovascular disease. Latest anti-obesity drug trials show major heart benefits. Groundbreaking clinical trials demonstrate substantial cardiovascular benefits from anti-obesity medications, specifically through GLP-1 receptor agonist treatments. The SELECT trial, involving 17,604 participants with overweight or obesity but without diabetes, marks a pivotal advancement in cardiology. GLP-1 receptor agonists reduce CV events by 20%. Semaglutide, administered at 2.4 milligrams weekly, reduced major adverse cardiovascular events by 20% compared to placebo. Furthermore, the medication decreased systolic blood pressure by 3.3 millimeters of mercury and high-sensitivity C-reactive protein levels by 37.8 percentage points. These improvements occurred despite patients already receiving standard cardiovascular medications. The cardiovascular benefits extend beyond weight reduction alone. Notably, the SELECT trial revealed that semaglutide treatment led to improvements across multiple biomarkers, decreased waist circumference, enhanced glycemic control, improved nephropathy markers, and reduced lipid levels. Losing weight through different methods has been shown to substantially benefit heart health. In particular, patients who underwent bariatric surgery experienced notable improvements in heart structure and function. These included better left ventricular ejection fraction and improved diastolic function. Such changes are believed to result from the heart reversing some of the structural alterations caused by obesity. Clinical research further supports that weight loss improves the heart's energy metabolism, especially in individuals with heart failure linked to obesity. These improvements occur through various mechanisms, with a notable boost in cardiac insulin signaling. As a result, the rate at which the heart uses glucose for energy increased from 0.2 to 1.5 micromoles per gram, dry weight per minute in heart failure patients after weight loss. Tirzepatide, AI in cardiology, and CRISPR gene therapy. Tirzepatide, a GLP-1-based medication, has also shown impressive effects on heart structure. It reduced left ventricular mass by 11 grams and lowered pericardiac fat by 45 milliliters, compared to a placebo. These structural enhancements are closely linked to fewer heart failure events, reinforcing the connection between weight loss and improved heart function. The advantages of GLP-1 receptor agonists extend across diverse patient groups. For example, patients with a history of cardiac bypass surgery experienced a 2.3% absolute reduction in heart-related risks when treated with semaglutide. Additionally, combining these medications with lifestyle changes led to sustained improvements in key cardiac biomarkers, such as high-sensitivity cardiac troponin T and N-terminal pro-B-type natriuretic peptide. Artificial intelligence, or AI, is transforming cardiac diagnosis, achieving levels of accuracy never seen before. A major advancement comes from the Mayo Clinic, where an AI-powered screening tool identifies people at risk for heart conditions with an impressive 93% accuracy rate. Advanced machine learning algorithms are now analyzing electrocardiogram data with exceptional precision. For example, the AliveCor heart monitor detects atrial fibrillation with 100% sensitivity and 97% specificity. By processing vast datasets such as Mayo Clinic's collection of over 7 million ECGs, these AI systems uncover subtle patterns that might otherwise go unnoticed by the human eye. This ability significantly enhances the early prediction of heart failure. AI is also driving progress in real-time cardiac monitoring. Remote telemetry devices combined with AI-powered analysis allow continuous heart monitoring from the comfort of patients' homes. These intelligent systems interpret patient data in near real time, enabling the early detection of cardiac abnormalities. As a result, heart failure patients using AI-enabled wearable devices have experienced a 25% drop in hospital admissions related to cardiac events. One standout innovation is the TRADA platform, a discrete wearable device that tracks heartbeats and electrical signals simultaneously. It delivers critical alerts if arrhythmias are detected, with a special focus on the crucial 72-hour period after hospital discharge when patients are most susceptible to complications. AI uses natural language processing techniques to unlock the full potential of unstructured electronic health record data, turning previously overlooked information into valuable insights. The integration enables rapid extraction of clinical data from patient records, automated processing of large volumes of information, enhanced clinical decision support systems, and streamlined workflow optimization. The Mayo Clinic's AI cardiology team clearly shows the power of combining artificial intelligence with healthcare. Their innovative system helps doctors spend more meaningful time with patients by streamlining decision-making processes. By blending hands-on patient care with advanced data analysis, they're transforming traditional cardiac care. This approach allows for quicker treatment decisions and more accurate diagnoses. A key example of this progress is the LogitBoost algorithm. It analyzes 85 different variables to predict heart attacks and mortality rates with an impressive accuracy of over 90%. By examining clinical data, imaging results, and patient histories, the system provides personalized risk scores that help doctors tailor preventive treatments for each individual. On another front, CRISPR gene editing technology is revolutionizing the treatment of cardiovascular diseases, primarily through its application in transthyretin amyloidosis with cardiomyopathy, or ATTR-CM. Initially, this genetic approach targets the TTR gene in liver cells, aiming to prevent the production of misfolded proteins that damage heart tissue. The Phase 1 clinical trial of Nexiguran Ziclumeran, or Nexz, demonstrated remarkable efficacy in 36 patients with ATTR-CM. The treatment involves a one-time infusion of 55 milligrams. During the trials, a few patients experienced temporary infusion-related reactions, and 2 had brief increases in liver enzymes. Throughout the study, a single intravenous dose achieved a mean TTR protein reduction of 89% at 28 days. In addition, these reductions remained stable, reaching 90% at the 1-year mark. The treatment's impact extended beyond protein reduction, as demonstrated by several key outcomes. A median 5-meter improvement in 6-minute walk test after 1 year, 92% of patients showed stability or improvement in NYHA class, and consistent trends in cardiac biomarker stability. The Magnitude trial, which involves 765 patients, is the largest study to date evaluating CRISPR-based therapy for cardiovascular conditions. Early safety data has been promising, with most side effects being mild or moderate in nature. CRISPR-Cas9 technology, amyloidosis treatment, and new drug approvals. This ongoing Phase 3 trial involving CRISPR gene editing technology, which spans the United States, Australia, and Canada, will soon provide more detailed information on the therapy's long-term safety and effectiveness. The study design includes a 2-to-1 randomization ratio comparing the CRISPR-based treatment to a placebo. The therapy works through CRISPR-Cas9 technology, which allows for precise gene editing in liver cells, targeting the TTR gene. Early studies have shown that this method can substantially reduce TTR levels by up to 95% or more in animal models. When human liver cells were exposed to the treatment, there was no evidence of unintended genetic changes. Recent advances in treating cardiac amyloidosis are paving the way for substantial progress in cardiovascular medicine. The FDA has given I-124 evuzametide breakthrough therapy status, a major step forward in improving the imaging of this condition. This designation helps speed up the development and approval process for treatments that offer considerable benefits over current options. The FDA's decision stems from extensive clinical data involving more than 200 trial participants. Presently, I-124 evuzametide stands as the only diagnostic imaging agent receiving breakthrough designation for cardiac amyloidosis. The agent is remarkably versatile in detecting multiple types of amyloid deposits, including ATTR and AL in major organs. Tafamidis treatment, patient selection, and long-term outcomes. In fact, Tafamidis treatment has shown great mortality benefits, reducing all-cause mortality to 29.5% compared to 42.9% in placebo groups. The medication's impact extends beyond survival as patients experienced lower cardiovascular-related hospitalizations at a rate of 0.48 versus 0.70 per year. The refined selection process for treatment candidates now encompasses several key parameters: age threshold below 70 years, Eastern Cooperative Oncology Group performance status below 2, New York Heart Association class below 3, and biomarker levels within validated thresholds. Hence, these criteria have improved treatment outcomes, as demonstrated by an 84% overall 5-year survival rate among carefully selected patients. The selection process, therefore, remains vital for optimal therapeutic results. As a result of improved treatment protocols, survival rates have shown remarkable improvement. In real-world studies, Tafamidis-treated patients demonstrated survival rates of 4% at 30 months and 8% at 42 months. The treatment landscape has evolved substantially, with contemporary cohorts showing enhanced outcomes. At present, cardiac response rates reached 42% within 6 months of treatment initiation. The implementation of modern induction regimens, as well as stringent selection criteria, has led to improved early survival outcomes. Timely diagnosis, financial barriers, and healthcare system integration. The Mayo Clinic's extensive analysis reveals that timely diagnosis, in conjunction with prompt treatment initiation, has improved life expectancy in ATTR-CM patients. These advances, alongside enhanced patient selection protocols, have established a new standard in cardiac amyloidosis care. Financial barriers pose a serious obstacle to implementing breakthrough cardiovascular treatments. For Medicare beneficiaries, out-of-pocket costs can be as high as $2,758 annually for heart failure, with reduced ejection fraction, and $14,978 for amyloidosis treatments. These expenses are particularly burdensome for low-income patients who experience financial strain that is 10 times greater than that of middle-income families. The approval process for new FDA-approved medications, especially through prior authorization requirements, is a major issue. Additionally, high retail prices create further difficulties. For example, empagliflozin costs over $600 per month, and sacubitril valsartan exceeds $700. Fortunately, the Inflation Reduction Act of 2022 provides some relief, capping annual medication costs at $2,000 for Medicare beneficiaries starting in 2025. The healthcare system faces growing challenges in keeping up with rapid advancements in cardiovascular care. To address these, several important steps are needed to integrate these innovations effectively. Electronic health record optimization to support clinical workflows, implementation of remote monitoring platforms, development of streamlined administrative processes, integration of digital health solutions with existing care models. Challenges such as missing data, incorrect entries, and poor integration across different EHR systems present major obstacles. Most importantly, the transition involves reworking several key areas, including the digital capture of patient experiences and ensuring real-time access to essential information. Provider training requirements. With unprecedented challenges in keeping pace with cardiovascular innovations, the American College of Cardiology, American Heart Association, and Society for Cardiovascular Angiography and Interventions have established comprehensive training requirements. The pathway consists of 3-year General Cardiovascular Disease Fellowship, 1-year Accredited Interventional Cardiology Fellowship, optional additional post-fellowship training based on career goals. Competency requirements encompass 6 essential domains: medical knowledge, patient care and procedural skills, practice-based learning and improvement, systems-based practice, interpersonal and communication skills, professionalism. To achieve competency, providers must complete a minimum of 250 interventional procedures, with 200 focusing on coronary procedures. Primarily, this training ensures physicians can effectively utilize new technologies while maintaining high standards of patient care. The curriculum emphasizes working within multidisciplinary teams to provide comprehensive patient care. Conclusion and frequently asked questions. Cardiovascular medicine is on the verge of a major transformation as 2025 ushers in groundbreaking advancements across various treatment areas. These innovations include GLP-1 receptor agonists, which have shown a 20% reduction in adverse cardiac events, and advanced AI algorithms achieving 93% accuracy in early detection. CRISPR gene editing has proven highly effective in treating transthyretin amyloidosis, while new imaging agents like I-124 Tafamidis improve diagnostic capabilities. However, despite these significant strides, challenges remain in implementing these technologies. Healthcare systems must overcome financial barriers, as some treatments can cost up to $14,978 out of pocket. Training healthcare providers and integrating these innovations into electronic health records also require careful planning. Nevertheless, emerging data shows that these breakthrough treatments are set to dramatically improve cardiovascular care. Clinical outcomes have improved across diverse patient groups, with lower mortality rates, especially among those receiving targeted therapies. Enhanced patient selection and advanced monitoring systems are helping to set new standards in the field. As the field continues to evolve rapidly, healthcare professionals must stay informed about these new treatment options. Successfully adopting these innovations will require a balanced approach, considering both their transformative potential and the practical challenges of integrating them into current healthcare systems. Frequently asked questions. Question 1. What are the major breakthroughs in heart treatments emerging in 2025? Key breakthroughs include anti-obesity drugs showing notable cardiovascular benefits, AI-powered early detection systems, CRISPR gene therapy, targeting heart disease, and new treatments for cardiac amyloidosis. These advancements are transforming cardiovascular care and improving patient outcomes. Question 2. How effective are the new anti-obesity medications in reducing cardiovascular events? Recent trials show that GLP-1 receptor agonists, like Semaglutide, can reduce major adverse cardiovascular events by up to 20% in patients with pre-existing conditions. These medications also demonstrate improvements in blood pressure, inflammation markers, and overall cardiac function. Question 3. What role does artificial intelligence play in cardiology? AI is revolutionizing cardiology through machine learning algorithms that can interpret ECGs with up to 90% accuracy, enable real-time monitoring of patients, and integrate with electronic health records. This technology enhances early detection of cardiac conditions and improves clinical decision-making. Question 4. How is CRISPR gene therapy being used to treat heart disease? CRISPR gene editing is being applied to treat transthyretin amyloidosis with cardiomyopathy ATTR-CM. Clinical trials have shown promising results, with a single dose achieving significant reductions in TTR protein levels and improvements in patient mobility and cardiac function. Question 5. What are the main challenges in implementing these new heart treatments? The primary challenges include high costs of new treatments, with some patients facing annual out-of-pocket expenses of up to $14,978. Additionally, healthcare systems need to integrate new technologies, optimize electronic health records, and provide comprehensive training for healthcare providers to effectively utilize these innovations. Thanks for watching our GlobalRPh production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you. Your support means the world to us. It helps us grow and keep delivering exciting, high-value content. Stay tuned because the best is yet to come.